against behind. Good evening, fellow Toastmasters. What is a CBC? It sounds like a television channel, right?
Yeah.
Or maybe it could be chocolate, banana, coconut. No, it's not a food recipe that I'm going to talk about tonight. CBC stands for da-da-da, cell block count, my favorite topic. Cell block count is the most test that every doctor orders. Every time you go into the doctor complain for anything, they always order this because the cell count of your blood is very important to tell the doctor what happened to you. Before I continue explain what is a cell block count, let me explain to you what is a cell. Well, our body is composed of cells. Every single part of our body, nails, our hair, our skin, our internal organs, every single part has cells. And they are little, so we only can see it in a microscope. But I brought one that we can see it, a big one. It's one that you see every morning, and you don't realize it's a cell. It's an egg.
Oh.
That is a big cell.
Oh.
That's the cell wall, the skin, and I cut in half so you can appreciate the inside part. The yolk is the nucleus, and the white part is the cytoplasm. Our cells are the same way like an egg. They only have some variations, some different forms, but the structure is the same one. Now that we all know what is a cell, let's continue what is a cell blood count. Our blood has three major cells. It has platelets, red blood cells, everybody heard about this one, and white blood cells. The platelets are the one in charge of coagulation. If we have a cut, it could be inside or in the surface, these guys go there and they put the things together back. They are like acting like a glue. So if you have an operation, before you go there, your platelet count has to be good in order for you to recover from the operation or from having a baby. And if the platelet count is too low, even if you have a small cut, you can bleed to death. Now, the red blood cells, that's the giving. This one we have a lot in our blood. That's why we always see that color in our blood, red. The red blood cells, they transported, they carry the oxygens to every single part of our body. If we have the red blood cell low count, that's called anemia. And if it's too low, because maybe we are bleeding inside and we don't know, maybe from the gastritis ulcer, and if it's too low, we're probably going to need a blood transfusion. Now, the white blood cells, they are my favorites because they are soldiers. They are the defense bodies. When this one increases, that's what the doctor looks. He looks if these two are decreased, and he looks if these ones are increased. If the white blood cells are increased, it's because we have an infection or we have an inflammation. And the doctor needs to know what kind of inflammation or what kind of infection we have. We do in the lab, we do a differentiation of the white blood cells. And let me bring you to a microscope view. That's how it looks our cells under a microscope. These tiny purple are the platelets, remember the glue? These ones, the donut shape, are the red blood cells. And they are many of them. And their normal size are this way. If we found under the microscope these cells, we have to report it. These kinds are for sickle cell anemia. Sickle cell is a genetic disease from people who destroy their own red blood cells. And usually the treatment is blood transfusion. Now, let's go to my favorite ones, the white blood cells. Wait a minute, they're not white. They're purple. Why? What happened? Let me explain to you why. We get one drop of the blood, and we put it in a smear like this. It's a piece of glass. And we place the drop in here, and then we spread out the blood. We let it dry, we stain in different colors. So that way we can get these nice colors under the microscope. And we can do a differentiation of the cells that we see in there. So if we report many of these cells, a high amount, it's because we have bacterial infection. And the doctor said, oh, you have a lot of neutrophils? Okay, you have bacteria, let me give you an antibiotics. But if we have many of these ones, it's for virus infection, and the doctor just send you home and say, you can heal by yourself. In a couple of days, you will feel better. Even if you have high white blood cells, but you have many of these ones, it's a virus. That's how they know. Now, if we have many of these ones, with this pink granules, it's because the patient has an allergy reaction. So the doctor needs to find out what kind of allergy the patient has. We have more white blood cells, different kinds, but I just explain you the main ones. But also we can find, I forgot to tell you, 8 to 10 minutes. Also, we have another cells that we can see under the microscope. Cancer cells. Yeah, from the CBC test, we can tell the information to the doctor and he can diagnose the cancer. This is a white blood cell that is abnormal. And that's how it looks under a microscope. So I'm talking cancer cells in the blood. Now, we also can see parasites in the blood. Anybody here heard about malaria? Yeah, it's a parasite that you can get from a mosquito bite. And it goes to your red blood cells, and they destroy the red blood cells. That's how it looks. And the CBC test is the only way the doctor can diagnose malaria in a patient, because we can see it there. So you see how important is a CBC test, cell blood count. It tells you how's your platelets, how's your red blood cells, the white blood cells. It can tell you if you have cancer cells or if you have a parasite. There are more parasites. Tell you how you're doing it. It's amazing to see that world inside you, your blood. Now, you remember Jimmy? Jimmy the egg. Yes. His name is Jimmy. How I found out that? I saw a message from his brother. You want to see the message? Jimmy, answer me, please. Jimmy.
Poor Jimmy. Our next speaker is going to give